So this article summarizes two papers that I wrote with Joel and Randy Roth on the connection between opioids and homicide rates. So it comes as no surprise, I suspect, to anyone that opioid addiction has been a huge problem in the United States now for 25 years. And there has been a great deal of commentary about where in the country opioid addiction rates are highest and opioid-related deaths are highest. They tend to be somewhat higher in the Appalachian regions than in other parts of the country. And the commentary on the opioid crisis has tended to focus on small towns and rural areas in the United States where there are high rates of unemployment, high rates of poverty, and what two economists have referred to as opioid-related deaths as deaths of despair. The idea being that these are areas of the country in which despair is quite widespread, and opioid is, if you will, kind of a form of self-medication. But there had been very little work on the relationship between opioids and homicide rates. And that, we speculate a bit in one of our papers about why that might be. Unlike previous drug crises in the United States, let's go back, for example, to the late 80s and early 1990s, the crack cocaine epidemic. That was viewed primarily as a criminal justice problem. And there were lots of studies that linked the crack cocaine epidemic to elevated homicide rates. The opioid epidemic differs from the crack epidemic in some salient respects. For one thing, the opioid epidemic took off in the white population. Now, opioid-related deaths have also increased in the Hispanic and black populations. But the death rates have been higher in the white population. And perhaps as a result, the opioid crisis has been framed primarily as a public health crisis and not as much as a criminal justice crisis. And so that frame, it seemed to us, is one of the reasons why there had not been a lot of work on the connection between opioid use, opioid-related deaths, and homicide. So we decided to investigate. We looked, our measures of opioid consumption consist of opioid-related death rates in U.S. counties. And we looked at all U.S. counties in the United States, although some of those counties we grouped into clusters because some are really quite small. And we computed homicide rates in those areas over the period 1999 to 2015. 99 is when the opioid crisis really takes off, and it was running at very high levels through 2015. We wrote two papers. In the first paper, we simply wanted to know whether counties that had higher levels of opioid-related deaths might also have higher levels of homicide. We found that to be the case. Even after we controlled for, held constant, really almost 24 additional variables that could also distinguish counties on the basis of their homicide rates. So these are variables that measure the socioeconomic status of the county population, the racial composition and ethnic, Hispanic, non-Hispanic composition of the population. We also were able to obtain some really quite special measures created by the Gallup organization, who do the Gallup poll. These are measures that at the county level ask samples of residents questions basically about their emotional well-being. So we're really trying to get at this issue of despair, right? And so we had a variety of control variables and quite a large number. Even with the controls, we found that those counties with higher levels of opioid-related deaths had higher levels of homicide. So then the question is, well, why? What's the basis for that connection? And here we had to speculate, but we went back to the literature on previous drug epidemics and homicide rates, and that literature clearly shows that the connection with homicide is not directly through drug use or consumption so much as it is through the dynamics of drug markets. So initially, and we use that as the basis for a speculation about why we're finding the connection between the opioid crisis and homicide. Initially, 99, 2000, the first years of this century, much of the opioid crisis consisted of people who were overdosing on their own prescription or on opioids, OxyContin being an important example. Opioids they obtained from family members, from friends, and so forth. But over time, those supplies began to run out. Regulations limiting the supply of prescription opioids were strengthened, and as a result, people who wanted to continue to use opioids, more and more of them had to go find those opioids, if you will, on the streets. Urban drug markets and suburban and rural drug markets began to supply opioids in, so these would be illegal prescription opioids such as OxyContin and others to the population that wanted them. It soon became apparent to that population of opioid consumers that heroin, on a dose-by-dose basis, was both cheaper and more potent than the prescription opioids, the so-called synthetic opioids. And so we began seeing heroin-related death rates go up. Now, we couldn't really distinguish between heroin-related deaths and other opioid-related deaths. We put them together. But it is clear from the research, other research, that certainly by about 2011, we saw a big increase in heroin use and heroin-related deaths, and some flattening of synthetic opioid-related deaths until the arrival of fentanyl. Fentanyl makes its big kind of arrival on the American scene in about 2014. Recall that our investigation period extends to 2015. And so we're not picking up a lot of the fentanyl-related deaths. And that turned out to be an advantage for purposes of our research. Fentanyl is a far more harmful, as I think everyone knows, a far more potent, far more harmful drug than even heroin. And so fentanyl-related overdose death rates just skyrocketed. But we're using overdose death rates as our measure of movement into opioid drug markets. Fentanyl-related death rates could go up simply without any expansion in the market, simply because it's more likely if you're going to do fentanyl, you're going to die than if you use some other drug. Sure. So in that sense, it was an advantage that we're not picking up a lot of the fentanyl-related deaths. So that paper concluded there is a connection between homicide rates and opioid-related death rates, and we interpret that connection primarily as the result of people moving into drug markets, which tend not to be very safe spaces, to obtain their drugs. Those markets are subject to disputes between sellers, buyers and sellers, and those disputes, they can't be settled legally because everyone involved is in violation of the law. Violence becomes a pretty potent enforcement mechanism under those circumstances. So that was our conclusion. We then wanted to know, and so did some of the reviewers on our original paper, well, what about change over time? You know, you've shown this connection at any given point between 1999 and 2015, connection between opioid-related death rates and homicide. But really, you'd strengthen the argument if you could show that in those counties where opioid death rates were increasing more, those were also counties in which homicide rates were increasing more. Good point. So in our following paper, we divided that period between 1999 and 2015 into three roughly equal subperiods, right? The first roughly 5 years, the second 5 years, and the third 5 or 6 years. And we looked at change over time over those three periods in our counties. Again, we used, a large number of control variables of the kind I described earlier. And we looked at changes in homicide rates over those three periods. And as before, we found a connection. In those counties where opioid death rates increased the most, we also found homicide rates increased the most. And we interpreted the relationship in the same way we interpreted the original relationship we'd found. That is, it seemed to us the most likely explanation is that as people moved into risky drug markets, that elevated their risk for homicide. We found in both of those papers, we found a connection between opioid death rates and homicide rates in the white population and in the Black or African American population. So, we looked at white opioid death rates and white homicide rates, Black opioid death rates, Black homicide rates, and found at any given point, we found the connection in both populations with homicide, and we also found the connection in terms of change over time. We interpreted our results pretty much as we had interpreted the results of the original paper. So those were the two papers. We've done subsequent research trying to find out if opioid death rates in the Hispanic, non-white, I should go back a step and say, when I talked about the white and Black populations, that's the non-Hispanic white and non-Hispanic Black population. But we wanted to know also what was going on with Hispanics. There had been one other paper published about the same time we published our first paper that did find a connection between opioid death rates among whites and blacks and homicide rates, but didn't find that connection among Hispanics. So in subsequent work we've done, we find the same result. We don't find a connection between opioid death rates among Hispanics, and they also had been increasing. They're lower than opioid death rates in the white population, non-Hispanic white population, but there's still variation across counties in them and variation over time. We found no connection for Hispanics, though we had found a connection for non-Hispanic whites and non-Hispanic blacks. So the obvious question there, well, why not?
Yeah.
We had no reason to believe that the Hispanic population was obtaining its opioids in safer spaces, although there has been some speculation that where a lot of Hispanics, especially in the southwest portion of the country, where much of the Hispanic population remains concentrated, Hispanic drug markets may well have been safer than drug markets operated by whites or blacks. And the reasoning went as follows. The Hispanic drug markets were much more likely than other drug markets to be dominated by, indeed run by, cartels out of Mexico, also operating in the United States. And the idea here is they're relatively well organized, and they have an interest in minimizing police presence.
Right.
And so they have an interest in minimizing violence. So that's one speculation about why it could be that we didn't find a connection between Hispanic opioid death rates and homicide rates. We're still kind of in the midst of that research. We haven't published on, actually we did publish a paper, an early paper on Hispanic opioid death rates and homicide rates, and it didn't get accepted at the journal where we submitted it. And the reviewers essentially said, oh, there's more research than you've cited. And, it's a decent point. And so we've kind of gone back to the drawing board, and we'll see where that goes.